Can travel from the center part of the chest to the left shoulder, to the jaw, and also to the back of the chest. And sometimes pain travels from the chest to the fingers, medial two fingers. So some of the symptoms, sometimes patient can complain with abdominal pain, especially with the risk factors, like all the risk factors like we discussed in the previous slides. Even though you have pain in the stomach, you can still go to the hospital for ruling out heart attack. But these, unfortunately, people with the diabetes don't have any of these symptoms at all. They can come with a heart attack. They can go to the hospital with a stomach issue, they found heart attack. As I explained that this is a different symptoms like back pain, sudden dizziness, burning feeling, and these symptoms are most common in men. In female patients, these are more common here. Nausea, vomiting is more common, but pain is more common in men. Next one, this type please. EKG can find out about 50% of the heart diseases. And what we do, as I explained to you, the electrical connections in the heart, that will be transmitted to the chest. We putting some leads in the chest, like all these different leads, then we can get the picture like this. So this is there are about leads in the chest and also in the leg and the arm. That gives a lot of information about the heart. Next slide, please. This is a normal EKG. This is P wave is atrial contraction, QRS is ventricular contraction, the T wave is a ventricular depolarization. The P wave atrial depolarization falls somewhere in the QRS complex. This is a pretty normal EKG. See this ST segment elevation. This is ST segment from here to here. ST segment elevation, that is a heart attack. Later, there is this R wave disappears. You can see more big Q wave. This is a ST elevation heart attack. That means we can see significant changes in the EKG. There is this one, non-ST elevation heart attack. There is no ST segment elevation, there is ST segment depression that can give a heart attack. When compared to these two, this is more dangerous than this one. Next slide. Echocardiogram is an ultrasound of the heart, like passing the sound waves and get the information about the heart. That will find out more about the heart valves, size of the heart chambers. Any portion of the heart moving right will get the information too. The second diagnostic modality is a stress test. If patient does not have any risk factors, we do a little bit chest tightness, we do a regular walking stress test. That will give a lot of information if any changes in the EKG. If there is some changes in the EKG, then we need to go for cardiac catheterization. Some patients cannot walk. In that case, we do the pharmacological stress testing like a Lexi scan stress test and dopamine stress test that gives more information. If the test is positive, definitely we need to consider for cardiac catheterization or angiogram. Next slide. If patient, this is a cardiac catheterization. What we do, put a small tube in the groin, pass the tube all the way to the heart, and the tube is engaged in the left artery. We take the pictures, and this is where the tube goes from here, from the groin to the heart. This is a left artery, left coronary artery angiogram, and this is left and right. This right looks so clean, whereas the left looks some blocked artery here. Next slide. So nowadays we do more like angioplasty with a stent. Olden days we used to do angioplasties alone. Put a small tube with balloon and inflate the balloon, take out the balloon. Then this is clogged about 80 to 90%. This may be clean after angioplasty. After a few months, it comes back like this. So that's why we started doing more like a stents. Stents is more like a metallic spring like this. Previous like this. This is a tube with a balloon and stent. What we do, we inflated the balloon, and after we inflated the balloon, we take off the balloon, the stent is going to stay there. Nowadays, 99% of patients can have stents. Next slide. This is a bypass surgery. If you have 3 or 4 blocked arteries, and if any pumping issue also, then we need to go for bypass surgery. This is the right internal mammary artery. This is a normal artery in the chest. We disconnect from the muscles and attach to the coronary artery. This patient had blockage somewhere here, and the bypass graft is opening the vessel. Now, how to prevent the heart attack, an angina, or chest pain, or congestive heart failure? We need to stop smoking, eat healthy vegetables and fruits. Exercise is very important, and take medications if you are prescribed, and know your number. Like number means BMI, body mass index, and nowadays you can do yoga also that can help you. Dietary guidelines. Limit your calorie intake, especially carbohydrates. You can eat more protein food, and avoid excess alcohol consumption. Limit foods with high saturated fat. You can go for more polyunsaturated fat that can give more better cholesterol numbers. You can eat, generally for hypertension patients, we suggest 2 grams or 3 grams sodium diet. Generally, normal people take 6 to 8 grams of salt every day. Even though it is 6 grams is very liberal, I suggest only 4 grams per day. Avoid alcohol. Drinking socially should be okay. If the patient is alcoholic, limited drink to 1 to 2 alcoholic drinks a day. How high cholesterol content is seen in egg yolk, meat, liver, butter, chicken, and fish is better. And the salmon fish or any other fish has high fatty acids that can help for the heart. These are some of the foods you need to avoid, like ghee, butter, cheese, and all these are some North Indian sweets and ice cream you need to avoid. And these also you need to avoid. Okay, next one. Exercise is very important. Most of the patients who come to our office and the hospital, their body mass index is more than 35 to 40, and they're very sedentary lifestyle, and they do not exercise. So if you take 10,000 steps a day, that is equivalent to 5 miles a day. And with your busy life schedule, we cannot do 5 miles a day. At least 3 to 4 times a week, that should be enough. And if you have time, do 1 hour exercise, like mild exercise or moderate exercise, that should be fine. There's a small joke here. If you don't spend 1 hour being dead at 24 hours, you are free. Next slide. The cholesterol numbers, the total cholesterol is less than 200 is a normal, and the LDL goal is about less than 100, you need to maintain. And HDL should be more than 100. Triglycerides, the fat content in the blood is should be less than 150. 150 you should maintain. These are the ideal numbers. with healthy individuals. If you have any significant coronary artery disease, your total cholesterol should be less than 150, LDL should be less than 70, HDL should be more than 40, triglycerides is still 150 and less. Benefits of reducing cholesterol: 10% reduction of blood cholesterol produces 20 to 30% decline in coronary heart disease. Next slide, please. Controlling blood pressure. Normal number of blood pressure is 120/80. If we have any high blood pressure, 140/90. Try to reduce with lifestyle modification like exercise and consumption of low salt diet, about 2 grams to 3 grams sodium diet. Next slide. Controlling blood sugar. Normal blood sugar is less than 100, and postprandial after 2 hours of eating 140, and you need to maintain the blood sugar for the diabetics less than 100. Diabetics also should do diet control. Ambulance comes, what you have to do with the patient? Keep the patient comfortable. Take all the tight clothes, and please do not give any water. And I ask him to keep it more like comfortable until the ambulance comes. And if any person in the family has heart disease and they take nitroglycerin tablets, please keep the one tablet underneath the tongue. That can open up the vessel, can reduce the pain also. And that's what we can do. Unless the patient stops breathing, then you need to do CPR, like compressions on the chest, and sometimes you have to give the breathing also. Once the ambulance comes, they take over. Nitroglycerin is a pharmacological name. Nitrostat, nitrolingual spray, those are the medications. No, you can give aspirin. If you have an aspirin at home, you can give an aspirin. But don't give too much water, you may vomit. So 1 baby aspirin and 2 baby aspirin you can give. That can help temporarily.
How long will, if a patient gets a heart attack, and how long there is a duration which is termed safe before which he can be transported to the hospital or something?
If the patient has chest pain, you should call 911. They will definitely immediately take him to the hospital. And unfortunately, 5% of the patients, those who have a heart attack, they die before they reach hospital. 5% die in the hospital. Another 5% die after discharge from the hospital. We're talking about 15% mortality. It's a lot of mortality. It should be every second counts. If the patient has chest pain, if you think the patient has heart attack, the symptoms I explained, like sweating, nauseous, and headache, dizziness, you should call 911 right away. And as early as possible, they have to go to the hospital. Once he goes to the hospital, they give you the medication, like a thrombolytic medication. That is mostly the clot is the main factor. It takes care of the clot. If the nearest hospital is like a St. Francis Hospital, they do angioplasties and stents. They directly take to the patient to this lab, cath lab, and they do the angiogram, angioplasty, and the stent. Unfortunately, the patient has 3 significant vessel disease, then they take him to the bypass surgery.
One more question. So we do the general annuals every year. So they just do the blood test. I'm guessing. So can a heart attack or a some bad valves can be detected during those annuals, or we have to go for a specific checkup or test be done?
Okay, mostly you can have a baseline cholesterol from 20 and above. I have seen youngest patient had a heart attack about 10 years ago, about 20. And oldest patient, 90, 95, 70s, is not limit for that. Youngest patient, 20, had a heart attack. He's a police officer, just a selected police officer. And he's extreme stress, first job, and he came to the hospital with a heart attack. He doesn't have any risk factors. I explained all the risk factors. I explained. Stress definitely can.
So you can have a clean bill of physical health, but still stress could cause a heart attack.
You can do that, yeah. Mostly have blood pressure checkup, And cholesterol check, 20-25 is above, and all the numbers look good. And if there is no other risk factors like no family history, family history is very important. Even though they will not eat anything, whatever I explained, they still have high cholesterol. Their body is generating a lot of cholesterol, no matter what you eat. They need medications like statins and other medications.
Any other questions?
So, నాకు ఒక generic question ఉందండి. It's about the diet basically. Maybe నా question చాలా మాత్రం ఉండే ఉంటుంది. So మార్కెట్లో there are so many diets. ఇప్పుడు యూట్యూబ్ ఓపెన్ చేస్తే 100 మంది 100 డైట్ ఫాలో చేస్తున్నారు. Someone says drink coconut oil. Somebody says don't drink coconut oil. Someone says eat as much as egg yolks. Everything is good. Someone says okay, hardly eat 1 or 2 whole eggs. Right? So I think everybody is confused which diet we need to follow. What's your suggestion?
You're talking about Virmachinini diet?
I don't take the names, but there are so many things, right?
There's Virmachinini, keto,
Yeah,
paleo, so many things.
Yeah, basically don't trust them. When I went to India recently, in March I went to India, few of my friends follow the Virmachinini diet. 5 patients are hospitalized, about to die. Almost about to die, unfortunately. They were given a lot of fluids and they're okay. Unfortunately, nobody died. So basically they're starving the essential diet. So we don't suggest anything. What you can do, basically you can take protein, most protein food, less carbohydrates. If you have to eat rice in the daytime, this should be fine. Night time, go for chapati. Eating chapati means not like basically limiting your intake, calories intake. So, red meat, try to avoid meat. Once in a while is okay. Once in 2 weeks, 3 weeks, you should be okay, but don't eat red meat every day. The first one is the second one is the food. The third one is alcohol, fourth one is other stuff. So mostly you can, as I suggested, buy a Fitbit, walk 10,000 steps every day. I know it's very hard to do it. I used to tell my wife, I make 10,000 feet every day without any problem. She bought a Fitbit for me and tried to walk in only 5,000, not more than that. I had to walk and take interest and try to walk on my own, then make it 10,000. The equivalent to 5 miles. You may not do 5 miles every day, at least do 3 or 4 miles. 5,000, 6,000 steps should be okay. But do it 4 to 5 times a week. And set some time, 10-15 minutes for the regular exercise, like walking on a treadmill, jogging and running. Especially people gain weight in winter times. And that's so very dangerous too.
Dr.Narla, I have a big question. We have recently seen a couple of friends who has felt discomfort in the chest and they never thought they need to go to the hospital immediately. And at the end, it's, the result is on the other side. Okay? They're no longer on the end. So, what point of time they should be concerned? Sometimes we have a discomfort comes and goes, right? So, what is an alarming situation where they should not be neglected, right? So, does it start as a mild and then, can you elaborate what point of time we should be concerned in calling an ambulance?
Yeah, the chest pain, and especially when you walk for a few minutes, if you have tightness in the chest, going to the arm and shoulder and back, associated with more like sweating, that is the main indication of significant angina. Not every chest pain is a heart attack.
How can we narrow it down, right?
Yeah.
So that's a difficult part to identify.
If you have only chest pain at rest, when you lie down on the bed, chest pain is not real pain. Because once you walk from here to outside, you have a little bit tightness, that's important. And the rest to chest pain generally doesn't. Also, the pain lasts for a few seconds. Just do the 5-6 seconds in the course is not real chest pain.
Yeah. Thank you.
Right.
So when somebody has a chest pain, lie down, then see if chest pain continues and then alarm.
Right. If the pain continues about a minute or two, then take aspirin, call 911, and you have to take.
My question is about HDL. So if HDL is lower, what we can do to improve the HDL?
HDL can be increased by exercise, can be increased by statins. Any statin can increase the HDL. Exercise itself can increase 8%, and statins can increase 8 to 15% of HDL. Unfortunately, all Indians have low HDL, especially men. Low HDL. Unfortunately, all Indians have small arteries compared to other races. Unfortunately, there is a study done by a doctor from Kerala, and they found that all Indians have small vessels and they have high lipoprotein little a. This is a special kind of fat. It's in our body, and that's why they start some medications for that.
When you get chest pain, will high breathing help you? Heavy breathing?
What?
When you get chest pain, will high breathing help you?
No.
Deep breathing?
No. Take normal breath. High breathing will blow out carbon dioxide, may feel dizzy, may pass out too. Normal breathing should be fine.
I have a question regarding silent attacks. Can you describe more about that? Because recently we see a lot of sites and by sleeping itself, some people they don't even know, and at the morning they say they didn't by sleeping itself.
Yeah, especially diabetic patients have silent heart attacks. They do not know. Sometimes they go to hospital and they do EKG that shows significant previous heart attack, recent heart attack. And you go to a hospital or physician, some other issue, they find abnormal findings. Then they discuss you had a heart attack recently or a longer time back.
So everybody needs to read their physical report to see their LDL, HDL, make sure they're at the right levels, then follow the preventive things of eating right, working out.
And exercise is more important. As in the pyramid, the first one is exercise. Pyramid, yes. Exercise. The second one is eating vegetables and fruits. Limiting red meat and walking every day. And don't smoke. Even if you smoke, quit smoking from today. And alcohol, limit alcohol. And somebody said, okay, I can have 1 glass of wine every day, my cholesterol is high. And couple of studies showed that alcohol can increase the good cholesterol, decrease the low cholesterol. But that can become a habit. If you start drinking 1 glass, if you have 2 glasses, 3 glasses, you'll be alcoholic soon. That's why we don't suggest to drink alcohol to reduce the cholesterol and decrease the risk of coronary artery disease.
But the wine, they say red wine is,
It's only red wine.
So the other thing is,
we have seen prawns in your the pyramid, the Mediterranean pyramid. Generally, it's said that prawns are not that healthy. You will have a lot of fats.
I mean, shrimps, you mean?
Yeah, yeah.
Shrimp, little shrimps are okay. If you take about 10-15 shrimps, big shrimps, then that has cholesterol too. Yeah, a little bit is okay. But more like a mixed diet.
What about the oils? There's a lot of oils in the market that they say
Olive
omega
oil.
and all that.
Olive oil, canola oil.
Okay.
No, don't buy any other oils.
Okay, that's a good tip. Everybody, oil, canola or olive oil, as
Olive oil,
Dr. Narla said.
If you want to fry some stuff or deep fry, don't use olive oil. Use canola oil. Like if you want to make a gayalu, don't use canola oil.
So statins, you told about statins, right? Is there a way we can get them food naturally rather than rely on medicines and all?
The first step is to try with exercise and food. Then if it doesn't go down, then you have to go for statins. Mostly we suggest the patient go for exercise and eating right. And if it's still high numbers, then go for statins. There are a lot of statins. The first statin is recently is rosuvastatin. The first one is simvastatin. All the statins are there. But statin has some side effects too, like muscle pain and also the liver involvement and body pain. So if you take statin for many years, sometimes you may feel a little bit